Then there's justice as the other dimension. In other words, fairness with equal distribution of the benefits to all. This comes into consideration, especially when you, let's take you to the community. Resources is a thing that is limited in South Africa, in the government sector. Yes, one patient that has a severe oozing wound. But there are other patients that come in alternative days for their wounds, but this patient has a severe oozing wound needing lots of dressings every day. And it's been used up by this patient so that when the other patients come, they cannot get a proper dressing. Justice means equal distribution to the benefits for all. Justice can also mean that whenever it's doing a thing in a situation, and then the next time it happens, then you stand back and say, no, I'm not going to do it. And that is where the thing where we say we're creating a precedent. When we work out of our scope of practice, then it's injustice to the patient. If you can do something. I think also our, like for example, if we know about someone who needs ARVs, you know about the ARV clinics in the government sector? Okay, ARVs. That if one person is entitled to the drugs and the treatment, the next person should also be, it should be available to that person. Another thing was, my daughter is a final year opera student. She's very gifted. She's at UCT. She developed TB last year of just below her vocal cords in the trachea. Nothing in the lungs, just below the vocal cords. We have a medical aid. She was diagnosed by means of a biopsy after a bronchoscopy. Then I reasoned for myself, but look here, the government gives free TB treatment. Why must I pay like 800-900 rand a month and milk my medical aid? Then my child can also go and go stand in the line for that because it's a free service. It's a communicable disease and she got a drugs there. It's justice, it's a distribution, equality amongst everyone for everyone, right? But we cannot withhold certain treatment from a patient saying that it's only for this specific group and not for that. Sometimes this happens, I know in the government sector with the dialysis. If you need dialysis, the machine-operated dialysis, not peritoneal, then there's a committee who sits to determine, are you eligible for dialysis? You know about that? And that poses also a big ethical dilemma for the nurse, because she's not the only one deciding that or carrying out a prescription for a patient. And then we can reason, yeah, but it's there, it should be justice. My approach should be that everyone should be able to get it, but there's a committee sitting, and they have their criteria. Or a patient who is, you know, we nurses call the patients bekwam. When somebody asks a lot of questions, and we say the patient is bekwam, then we say, if you want such care, why don't you go to a private institution? But actually, the patient is keeping us on our toes, which is the ethical dilemma for us, and we should not react like that, because we must treat everyone and approach the dilemma with a dimension of justice. There should be equal distribution of all the benefits for everyone who is a patient. Okay? Can you see I put the respect for persons on a scale, and the beneficence and justice especially must balance each other out. Okay.